Hello, everybody. How are you doing? My name is Luis Rodriguez. I am the Executive Director for RGB Lead. We are an organization that focuses on helping to build and facilitate relationships within the Rio Grande Valley for K-12 programs, schools, higher institutions of higher education, along with the workforce. So thank you for joining us for the 19th annual Career and Education Expo. We definitely appreciate you joining us. Some of you may have already heard from me to begin with. Some of you, this may be your first session. The Expo started in 2004, and it provides opportunity for employers to showcase their careers. In addition, we've added colleges and universities to showcase their related educational opportunities, providing exposure to high school students to learn about Valley opportunities here in the Valley and interact with the representatives of these organizations. Typically, we have had this in-person event, and it's been a one-day. Unfortunately, due to the pandemic and for the safety of all, we are doing this virtually. So thank you for joining us. This is part one of health science. We have part two at 1 o'clock. So if you want to join us at 1 o'clock, please do, and we'll get going. We'd like to thank our partner agency, Workforce Solutions Canada. They have partnered with us for several years now to make sure that this is a possibility. We'd also like to thank Texas Gas Service, who is a gold sponsor, and a bronze sponsor, Harlingen Manufacturer Association. We definitely thank all of them for helping us make this a reality for you as juniors and seniors. So thank you so much. Next, we have an opening video welcoming by Pat Hobbs, the Executive Director of Workforce Solutions Canada. So I'm going to turn off my camera. I'm going to go ahead and start his video.
Good morning. I'm Pat Hobbs, the Executive Director of Workforce Solutions Cameron, one of the sponsors of this Expo event with RGB Lead. I'm so happy that we have this opportunity because of the pandemic to find a virtual solution to keeping the Expo going, because I think it's critically important for high school seniors to be able to see the jobs that are available, experience some discussion with the potential employers of their future, and be able to make some decisions that need to be made in order for you to be a part of the future workforce of Kennedy County. Now, I say that because part of my job is to make sure that the proper workforce is developed to meet the needs of our county employees. And I think it's critical that before high school students make those endorsement decisions in the 9th grade, that they have a large degree of career exposure, maybe some internships, whatever, so that by the time they make the endorsement decision in the 9th grade, they know where they're going more or less, at least a career pathway, and can take some CTE courses during high school and then progress to post-secondary education, either in a community college or a technical college, to build their skill level so that they'll be employed within the workforce. Now, I want to also say that as I've been in this position for 10 years, I've watched the workforce change, the dynamics of the workforce, the speed with which technology is changing things, artificial intelligence, robotics, the internet, all of those factors are doubling or tripling our knowledge base every 2 or 3 years. And that's an important thing to consider. The old style of everybody going for a 4-year degree, some of which the degrees might not be very valuable anymore, are really losing out in the future. You need to consider certificates and associate degrees and moving into the workforce with skill sets that are self-employed. Everything is working at such a rapid pace that speed is of the essence. And I challenge you to do your homework, do your research, visit the websites of both my agency, Workforce Solutions Cameron, and use the videos that we have available to teach you how to do career campus outreach, career search, visit the types of jobs, get the statistics on what those jobs pay, and what the availability and demand is. And really make a good decision on where you want to go with your career path.
We have our ranges already.
Sorry.
I think that we have an opportunity during this COVID pandemic to take some time to really study our career approach for the future with your parents, with your counselors, and make good decisions on your career pathway because it's important. Without skill sets, you have no job. Without a job, you have no future. So welcome to the Expo. Learn as much as you can, get exposed as much as you can, and please visit our websites to gain even more information. Thank you.
All right, we'd like to thank Mr. Hobbs, Executive Director from Workforce Solutions, Cameron, for that opening welcome. All right. Oh, sorry. So next, I want to direct you to the next couple of slides and visuals you'll see is a report from the Labor Market Report, which RGV Lead puts together every 2 years. And we provide valuable information for high school students, workforce development boards, economic development corporations, along with educators trying to help students kind of decide a career path for them. You'll see on this sheet, this is based out of health science. This is local occupations. This doesn't include anything outside of the Rio Grande Valley. So let's take a look at dental assistants and then dental hygienists. It's the third and fourth one. So what you see there is you see the dental assistants, what an entry-level wage is, what the average wage is, and what an experienced wage is, and that's based on data that we have collected here from the Rio Grande Valley. That's more or less what you can expect as in that position. Every year, we anticipate estimated annual openings of 115 positions. And then for the education and training, you'll need a 1 year. So what that includes is in our labor market report on page 76, it'll show that 1 year means a post-secondary certificate is required to get this job. The length of this certificate varies, ranging from a few weeks to 1 year or more, depending. And then same thing for the dental hygienists. You'll see their entry level, their average, and then what experienced dental hygienists make. How many openings there are? There's 43 openings estimated on a yearly basis. They do need a 2 year, which is a associate or an associate applied science degree. And then they will need a license certification. So that's based on the state of Texas, whatever license that includes. And this labor market report goes very in depth in not only health sciences, but every other field that you can think of here in the Rio Grande Valley, so long as it falls within the Texas Education CTE programs of study. So there's a lot of great information within this labor market report. I definitely suggest you take the time to visit our website, rgvlead.org. Look under the publications. You'll see 2019 labor market report, and it'll give you all this information. You'll see on the next slide, on the next visual, very similar in regards to for the health and science, the local occupations. You can see a list of all the different types of local occupations that are here in the Rio Grande Valley that we've been able to get information about, how many openings. You'll see that registered nurses, which is a big one, annually has 587 positions that are open. And that requires 2 or 4 years or 6 years plus a license. So the 2 years is the associate or associate of applied sciences degree. 4 years is a bachelor's degree, and then 6 years is a master's plus a license. So there's different stages in that, but this gives you, like I said, valuable information. So if you have an opportunity, take a look at it. Say, if you're interested in any of these fields or any other fields, it's going to give you great information. This publication takes about a year to produce. It is an extensive project because of all the data research that that our individuals that we work with are collecting and compiling and then putting together and then making it as something that will be useful for you all here in the Rio Grande Valley. So take a moment to take a look at this. Definitely, you'll definitely get some great information. All right, next we have our first presenter. This is Mariana Tumlinson. She's the Director and Community and Public Relations for Valley Regional Medical Center and Careers in Healthcare. So Art Garza is, I believe, going to be on the video, the CEO from Valley Regional Medical Center.
Hey everybody, this is Art Garza. I am the Chief Executive Officer at Valley Regional Medical Center in Brownsville, Texas. I want to share with you a little bit about who I am and how I came to be a hospital, my career in healthcare. I'm also going to spend some time sharing with you the different options that we have in healthcare as a career. So, a little bit about myself. I was born in Brownsville. I'm the youngest of 3 children. My father and my mom are Winston Trina Garza, and I grew up just off of Boca Chica and McDavid. So some of you might be familiar with that area, but I went to elementary school at Victoria Heights, and then I went to intermediate school at Cummings, and then I eventually graduated from high school at Hannah. So I am a former Golden Eagle. How about that? I was born into an average family. We weren't rich in any way. We were blue collar, hardworking. Really just had the best upbringing because of some amazing parents that instilled the value of hard work and commitment and being focused. And so after graduating from high school, I enlisted into the Army, and I was an Army X-ray tech during the first Desert Storm. So this is many years ago, but after completing my commitment in the Army, I enrolled in Texas Southmost College's Radiology Technology program. And eventually I graduated from that program. I enjoyed myself a lot. I had a great time learning a lot about the profession of taking X-rays and how radiology departments work. I eventually became a multimodality technologist, which means that not only was I able to do, I did CAT scan, I did MRI, I did a little bit of ultrasound, I did a little bit of nuclear medicine, and I became registered in most of those modalities, which allowed me to grow over time into different jobs. And it allowed me to continuously get promoted into bigger jobs, ultimately leading to a directorship position, which was at that time the person who was responsible for all of the employees and all of the department associated with taking medical imaging procedures in a hospital. It's a pretty big deal. Today, the X-ray program at Texas Southmost College continues to exist. It's an amazing program, and it's quite challenging, but it's a really well-structured program that allows you to go through the curriculum, take your examination, become certified, and become licensed to be an X-ray tech in the hospital. And that, of course, leads to so many different opportunities, as we'll see in just a minute. After I finished my career in radiology as an X-ray tech, I continued to go to school. I eventually got my bachelor's in science from the University of Texas in Galveston, and then I finished my master's in business. I did that online through the University of Phoenix. I became part of a leadership team within the hospital, and that expanded beyond just my role in radiology. So by this time, I was able to have leadership positions in different parts of the hospital, still focused on continuing my growth. Eventually, I decided that I wanted to try to become a hospital executive. Now, this is something really big for me because I never thought, even today, when I think back many years ago, never thought that I would be a hospital CEO. And it's very, very competitive, very, very challenging to get to these positions. and it's even harder to keep these positions. And so I'll tell you that it's been very rewarding. I've traveled throughout the country and worked at many different hospitals over my career. I've been with this company for almost 30 years, and I've been able to enjoy a lot of opportunities that the job and the company has provided me. So, when you're thinking about careers in healthcare, please consider that it takes more than just nurses. It takes more than just doctors to be able to run a hospital. There's so many careers in healthcare, as I've already mentioned, and everyone on the team is responsible for making patients better and for helping them get past their hospital admission and move on to lead healthy lives with their friends and their families and those that they love. So let's look at a few careers in healthcare. I'm going to start with this one. This is a picture of a few of our X-ray techs that work in the special procedures department. They started their career just like I did. They work in a specialized department of the radiology department that deals with all of the vascular structures within the body. And so this is called special procedures. And in the picture, you'll see Danny and you'll see Angie, who's a nurse. And it's really important for you to understand that no matter what we do in a hospital, no matter what role you have, we're all working together to support the patient. Another really big important career is respiratory therapy. And so here you see Pat. Pat is one of the managers in the respiratory therapy department. He graduated from a program very similar to one that's offered here in Brownsville at Texas Southmost College called the Respiratory Therapy Program. On average, for the majority of these programs, it takes about 2 years of training. And the great thing is that you don't even have to go home anywhere. You can stay here at home. So another one of the professions that we focus in Texas Southmost College or other colleges here locally is laboratory. So you can see one of our laboratory technicians who looking at a microscope as I'm trying to sneak in a peek. You'll see some really young folks in our hospital, like Alyssa, who's ER tech currently, but going to nursing school. This young lady's just 21 years old, just barely turned 21 years old, and she's almost done with her nursing degree. And that's such a huge accomplishment. The great thing about it is that she determined early on what she wanted to be, and looked at what it requires and the resources that she needed, and she set her mind to it. And many times, many of these employees come in one role. They go to school at night, they go to school during the day, they work on the weekends, and they're focused towards accomplishing those goals. And this is a great example. You know, you're thinking that it's just nurses and therapists and technicians. Well, you're wrong, because as I move through the rest of the slides, you're going to see that there are so many different roles to be played. This is Chicho, who's one of our cooks. And as you would imagine, when you have 100 to 200 patients in a hospital and you have a workforce of about 700 employees, they're going to be hungry. And so our dietary department does a really great job of feeding not only the patient, but the employees. And keep in mind that food is part of the healing process. We have a team of HR professionals, human resources professionals. And we'll see Olga, who's our nurse, and Tommy, who's a coordinator, and Liz, who's the VP of HR. They're responsible for making sure that all of our employees have the right certifications, right licenses that are required to practice their particular discipline, and make sure that we're abiding by workforce laws and regulations. And so, you can imagine how this department becomes really, really important, even though they never actually touch a normal patient. So here you'll see Javier working on some of the racks that are required to support the tremendous infrastructure of computers and technology that is required to be able to take care of our patients. These folks are very skilled. They have a lot of certifications, but their background is strictly in IT. And this is yet another example of how you can work in a hospital, but never even actually touch a patient or come in contact with a patient. The environmental services department is really, really key in making sure that our hospital is clean. But not only that, the environmental services department is responsible for reducing infection across the hospital. And you can imagine when you don't wash your hands, or you don't keep your clothes clean, or you don't keep your, your things clean, that opens up the chance of infection. And by having our EVS team constantly cleaning, constantly making sure that the environment and the rooms where our patients are housed at is clean, they too have a role in supporting patient care by reducing infection. We have accountants in our hospital. You'll see it, Rosalind is a accountant, and her responsibility is to make sure that every single month we track all the money that goes into the hospital and all the money that goes out of the hospital. You can imagine how that's a really important job. Fairly young, she's been at this for some time, but if you're one of those people who likes to deal with numbers, maybe this is a career for you, be an accountant in healthcare. It also takes a small army of individuals called engineers. And these individuals are responsible for making sure that everything behind the scenes, such as your heating system, your plumbing system, your air conditioning, and your medical gas systems are all working properly. You can imagine what it would be like if we didn't have folks like Hector on our plant operations team making sure that our building is nice and cool. You also have a supply chain, and these are the folks that are responsible for making sure that everyone has all the supplies needed, whether it's in the emergency or in the OR or in the cath lab, even in the administrative office. The supply chain and people like I am are responsible for making sure that we always have what we need at any given time. Their job is to get it, to make sure that everyone else can do what they're supposed to do. For the students, before I wrap things up, I want to leave you with just a few parting thoughts and a couple of slides. I'll tell you that over the course of my career, I've been really lucky to have some amazing people help me along the way. And the things that I'm about to share with you, in part come from them, in part come from things that I've learned on my own along the way. So I'm going to start with the first one, and that's to graduate. You have to stay focused on completing high school. You have to stay focused on completing your studies. You have to stay focused on what you want to do with your life as you transition to adulthood. And so all of those things can't happen unless you stay focused now and graduate from high school. Other thing I want to share with you is to simply get over yourself. I think that along the way, I've learned that I don't know everything. I've learned that there's many things that I don't know. And it's my responsibility to try to soak as much as I possibly can, learn from everyone around you, because there's lessons to be learned at every single juncture along your journey. So take advantage of that and let your ego go and realize you become a better person when you allow yourself to learn from others. I also want to tell you to be comfortable with not being comfortable. And by that I mean, as you grow, as you experience new things, you're probably going to feel a little intimidated or a little nervous, maybe a little anxious about that new thing that you're experiencing. Be okay with it. Embrace it, because there's value in learning from those things. And as you grow throughout your career, you're going to have to be comfortable with being uncomfortable. And then the last thing that I'll let you go, that I'll tell you, is just keep going. Don't stop. Stay focused on your career. Stay focused on what's important to you, whether it's your family or making sure you're taking care of yourself, your studies. All of those things are important to all of us. And you can't accomplish the next big thing if you don't just keep on going. So as Mark Twain said, the secret of getting ahead is getting started. The last slide that I'll leave you with is also another quote from Mark Twain. And that's the two most important days in your life are the day you're born and the day you find out why. So you're probably at a stage right now in which you're trying to find out what and why. And that's an exciting time for you. Take advantage of this, focus, and listen to your mentors and your family, your teachers, your counselors. There's a lot of wisdom there. Thank you for allowing me to share a little bit about myself and share a little bit about what's made my career successful. And most importantly, share with you the many, many different types of careers that you find within healthcare settings, specifically within a hospital setting.
We'd like to thank Mr. Garza for taking the time to be able to put that together and sharing the information with you all. Definitely a lot of great information within his session. Next we have from Sunshine Pediatrics, Mary De Leon. She's a nurse practitioner, and she's going to share some information.
Welcome, seniors, to the RGV Lead Career Expo. My name is Mary De Leon. I'm a nurse practitioner. I have two roles. I'm a family nurse practitioner and a neonatal nurse practitioner, and I work at Sunshine Pediatrics. We provide excellent care, and our goal is to provide comprehensive care to the pediatric community in our valley. We see newborns and kids up to the age of 21. Our goal is to make sure that we see that the developmental goals are met throughout their lifespan and also throughout the high school years, that make sure that you do lead healthy lives. And our goal is to make sure that as you grow older, you keep these good habits of healthy lifestyles, exercise, prevention of infections and all, especially this year in 2020. So my role in the office is to make sure that I see the patients and provide the proper care and help out the doctor that I am working for. We have a lot of people that help us out, and we do a lot of collaborative work. So those of you that are interested in medical billing, receptionists, medical lab assistants, or CNAs, we really use their skills to help us out, because I cannot do this job alone. I do need the girls to help me with making sure that they do the lab work, give the vaccines, they triage the patients, they ask all the pertinent information. That way, when they come to me, I am already ready, and my plan is focused on my visit on that day. Throughout the visit, we also do a lot of comprehensive care. So my job alone is to make sure that the child also is seen by a nutritionist. We also have people out there that help us out, such as your respiratory therapist, your speech therapist, occupational therapist, and physical therapist, because if these children cannot walk, talk, or eat properly, or function even to button their shirt, we do refer them out to make sure that they get that care that they are needing. The nutritionist helps us out for those kids that are a little overweight or even underweight. Make sure that they learn how to eat properly, make sure that they get the correct caloric intake, and continue to lead and learn how to eat properly. For you seniors, as you grow up and start deciding on what career you want to follow, make sure you get a mentor to help you out. They are there for you. When I was growing up, of course, I wanted to become a doctor at one point. I got my degree in biology, and then I just got married and had a child. But at that point, I still wanted to reach my goal to work in the medical field. So I went into nursing school and graduated from UTB with a bachelor's degree of nursing. And then I still continued to work as a nurse at the hospital in the newborn nursery and the NICU. I wanted to continue to work in pediatrics and work not so much as a doctor now, but as a nurse practitioner. So I decided to go to school and became a nurse practitioner. From there, I've been working at Dr. Jalil's office for 11 years as a family nurse practitioner, but I still wanted to go back, and I did 2 years ago, and I finished my neonatal nurse practitioner post degree. Even though I'm already older, I never stopped my dream of becoming of who I am now. And for you guys, never give up, never lose hope. Make sure that you continue to study. I still study every single day. I still read every day because I want to be the best at what I do. My advice for you seniors is to make sure that you don't go into a career for the money. You go into the career for something that you really love and will enjoy the rest of your life. Make sure that you always learn and read and keep educated and keep up to date with all the information and all the literature that is out there. Reach for the stars. Make sure that you never lose sight of your career. Make sure that you plan life as far as making the right choices and also never losing sight of your goal. If at any time, life happens, it's okay. Get back on track and keep on going. Remember where you came from. And if you have to come back and help us out here in the Valley, we would greatly appreciate it.
We definitely appreciate Ms. De Leon and the information that she has shared with us. As you can tell, she's talked about continuing education in her field, and that's vital. So just know that you can continue on and keep getting new certificates and new opportunities will open for you.
Welcome.
Next, we have Villalon from Texas Southmost College. She's going to talk about program and study of medical laboratory technicians. I'm going to play her video, and I believe she's with us. So in case there's any questions, she is with us, so she can answer.
Hi, my name is Dr. Consuelo Villalon. I'm the Medical Laboratory Technology Program Director. The program study is well designed because the students have a holistic experience. They learn the cognitive material, the psychomotor. The psychomotor they learn in the laboratory and in the clinical sites. But in addition, we teach the students the affective domain. Those are the marketable skills that the employers need to be competitive in the clinical side. Our program of study requires certain prereqs. The prereqs are anatomy and physiology 1, composition, college algebra, and statistics. The medical laboratory technology is great for you if you actually love the laboratory.
I enjoy the program mainly because it gives us an opportunity to work on the actual patient's specimens as well as being able to learn the process of testing. We're testing with blood, stool, urine, just different specimens and tests requested by the doctor or physician.
What I like about the multi-program is that you get to experience a lot of hands-on of what's going on in the lab. So you get actual samples and then get to use some of the instruments that are actually in the lab. I recommend high school students to think about attending the community college first and then continuing their education in the university. This is the right product. The medical laboratory technology graduates actually are working in the Valley, and some of them are techs, some of them are in the upper area of the United States, are continuing the education toward the clinical laboratory science degree or the master degrees.
I want to continue pursuing a bachelor's degree in medical laboratory science and continue possibly to even a manager position at a hospital.
Graduates can continue in the medical field, can continue in the engineering field as an engineering equipment techs. They also are serving the forensic labs, biomedical labs, clinical diagnostic labs, office, doctor's office laboratories. We have medical laboratory technology graduates in all our community. We're here to serve you. We're here to help you succeed. Come and you will enjoy the benefits of being a TSC student. Thank you.
We would like to thank Ms. Villalon for that video. I know she's with us. I there's any questions, definitely don't be afraid to ask them. That's what we have our panelists and our subject matter experts for. Ms. Villalon, I think you can unmute yourself. I did see just a question I did see on there. I think one of the slides had COVID-19, I guess, doing the testing or the running those samples. Is that something that, in this career field that they're going to be working with? I think she's with us. Okay, maybe we're just having some technical difficulties. Definitely appreciate the information. Next, we are going to have a live presentation by Scott Nelson. I'm going to make him a presenter really quick.
Luis, can you see that?
Yes, sir. We got your PowerPoint.
Right. Very good. Good morning, everybody. My name is Scott Nelson. I'm a paramedic and the EMS program director for Texas Southmost College. So we're going to talk just a little bit about some of the opportunities in this field. So one of the big questions is, where can I work? And really, you can work in lots of different opportunities. You can work in ambulance services, doing ground transport. Sometimes these are 911 calls, so people call for help, just like you might see on TV. And then we respond to those scenes. Sometimes they're car accidents, sometimes they're shootings, sometimes they're just somebody who's a little bit sick today. You could work in medical flight services, so you could work in helicopters, or you could work in fixed wing or airplanes. And these are folks that are going to be doing transports, usually within a couple 100 miles, but they're doing it in a very small space at high altitudes. You can work for a fire department. If you look locally, our fire department here in Brownsville is staffed primarily with paramedics, although not everyone is. So most fire departments require to be at least an EMT and then possibly a paramedic. We'll talk about that in just a second. You have the opportunity to work in special events. I loved over my career working at concerts. I've seen some big name shows and I didn't pay any money for it, which is a good thing. And I've also had the opportunity to work in other events like carnivals and amusement parks and so forth. So there's lots of things that you can do. And then if you're really adventurous and want to get outside of the normal work environment, you can work on things like oil rigs. You can work in cruise ships. You can work kind of anywhere you want to work, because there will always be a need for EMTs and paramedics. So we're going to talk about that. There's three main levels of EMS provider. There's an EMT, or emergency medical technician. There's an advanced emergency medical technician, and then a paramedic. And each of these has a different level of training or a different amount of time for training. So the EMT level is usually about 1 semester long. At our program, it's 1 semester long. It's somewhere around 200 to 250 hours of training. And includes the basic information you're going to need to know to be able to respond to an emergency and really just make an assessment of the patient and begin treatment. An advanced emergency medical technician can do all the things that an EMT can do, but it usually takes about 3 to 4 semesters of college work in order to be able to not only assess the patient and begin treatment, but get into some of the advanced treatments. We can do things like intubate a patient that would be putting a tube in someone's airway to help them breathe. We can start an IV and give some medications to help relieve pain or other symptoms or other problems. And then the highest level is a paramedic. And in Texas, and I apologize, there's a typo on there, it should be maybe certified or licensed. In Texas, there's 2 levels. There's a certified paramedic, and there's a licensed paramedic. And the difference between those is that the licensed paramedic has a degree. And what that will mean for you in terms of earning ability and income ability is that you might be able to make $1 or $2 more an hour than somebody who's a certified paramedic. Now, that doesn't sound like very much, $1 or $2 more an hour, but over the course of, let's say, a 2,000-hour working year, it's about 50 weeks a year working 40 hours a week, that gets you quite a bit more money. That can be an extra truck payment. It can be an extra house payment. It can be better gifts at Christmas, things like that. And when we start looking at the education requirements, we've got a certificate, which is usually less than a year. Most of these degrees, so the paramedic, for sure, being licensed, has an associate degree, but there is an opportunity to move forward in the career and get a bachelor's degree for things like supervisory work or emergency management training and emergency management work. What do you need to do in order to work? Well, you have to have completed approved training. What approved training means is that I can't just set up a training program in my garage at my house. It has to be approved by, in this state, the Department of State Health Services. There's an EMS division. And in order to train at the paramedic level, we are required to be approved by an oversight, national oversight committee, the Committee on the Accreditation of EMS Programs. Once you've got that training done, you have to get licensed or certified or registered. And the purpose of this is we want to assure that you have met certain requirements, that you can do the skills and have the basic knowledge that is required of an entry-level person getting into this field. So for EMS, we have the National Registry of EMTs. So I'm registered as a paramedic with them. They're not a state body, they are a national oversight body that just says that Scott Nelson has met certain requirements. From there, we end up going to the state. So in order to work in the state, I go through licensure or certification processing, which can include a criminal background check and a drug screen. And the purpose of this is for the state to say that you are a good person. We in this business, and really in all of healthcare, are put into a position of public trust, which means that we have the ability to go into people's homes, we have the ability to assist people at a moment's notice, and there's an expectation, a reasonable expectation, that we are good people. So the state has as the requirement of assuring that we meet that requirement, that we meet those levels. In order to continue working, as a previous speaker mentioned, there's continuing education. Keep moving forward with your education. The education we're giving you at the beginning is the building block. This is the starting point in a career. But over time, things change. Luis mentioned COVID a few minutes ago, and I think that's a great point to bring up, that you might see something different about COVID almost every day. That's because we're learning more about it every day, and we're building on the education that we've had before. So you're going to understand that we need to do continuing education. We need to update our skills, update our knowledge of the environment and of the world around us. So some of the basic job duties that we're going to do at the EMT level, we provide emergency care outside of a hospital. They call this the pre-hospital arena. We provide care and comfort for victims of accidents, injuries, and sudden illness. And as I mentioned, there's an EMT. This is a certificate level program. You can, in one semester, if you come to Texas Southmost College, in one semester, you are eligible to get certified as an EMT in the state of Texas, and then you can start working. And the places that most EMTs are working locally are ambulances, although there are a few EMTs that work in emergency rooms. Some of the standalone emergency rooms hire EMTs to work as ER technicians. At the paramedic level, this is a certificate or an associate degree level. They generally work on an ambulance, but can find employment in medical offices, hospital emergency rooms. I have some colleagues that have worked for orthopedic surgeons. They don't go into surgery, but they do some of the bone setting and the casting of patients. We also see these positions in other locations: fire, law enforcement, security. Again, special events, offshore locations. There's really, again, it can be almost anything that you want. To give you an idea on earning potential, these numbers are from Texas. So an EMT will make somewhere between $21,000 and $1,000 and $24,000 per year. And paramedics usually start at about $29,000 and can get up to $60,000 per year. That's all based on experience and based on where you are. Where we are here in Cameron County is probably going to pay a little bit different than, say, Austin and Travis County, because the cost of living is a little bit higher there as well. So if you look at our program, and I'm happy to discuss it with you today, or you can certainly reach out to me at another time. Our program is 5 semesters long. Our first semester is the EMT program. And while you're starting that, we're also starting you down a path to get the Associate of Applied Science. So we encourage you to take English composition. We encourage you to take a math class, usually college algebra or contemporary math. You're going to be taking a psychology class. You're going to be taking anatomy and physiology 1 and 2. And our goal is to make you the most well-rounded paramedic that we can. So again, it's 5 semesters. That first semester is EMT. The remaining 4 semesters are the paramedic training. And at the end of the first semester and at the end of the 4th semester, you're required to take and pass the National Registry of EMTs exam in order to be eligible for certification or licensure at that level. there's lots of opportunity. The projected growth is about 26% over the next 10 years, and that's growth. That's new growth. That's not just taking care of the people that are getting out of the field due to retirement or because they've gone to another area. If you have questions, again, I'm available. Please reach out to me by email. You can see my email on the screen there, scott.nelson@tsc.edu. If you have further questions about our program, our website is tsc.edu/EMS. And I will entertain any questions if you would like at this point.
I don't see anything on as far as questions. There may be something that comes up after.
Okay.
Scott, I will tell you some of the things you talked about. When I lived in Travis County in Austin, Texas, all those paramedics that were South by Southwest, ACL festivals, all the music concerts. I mean, just like you talked about, they got to see front hand, great acts and great opportunities. So, and they loved what they did. I was able to do a ride along one time with some paramedics because I was, considering the field, and it was interesting to see the day to day and what the career actually entailed. And it was interesting. It wasn't for me. I quickly realized that, but that definitely opened my eyes. So thank you for sharing the information with us. We definitely appreciate it. I'm going to go ahead and turn it over now to Beth, who's going to be the next from Texas Southmost College. So make her the presenter. Thank you, Scott.
Good morning.
Good morning.
We are presenting both the nursing programs for Texas Southmost College. So I am Beth Kasprisin. I'm the director of the Associate Degree Nursing Program, and I have with me also Molly Showalter.
And we don't see your PowerPoint.
You don't see it? It's up. It is. Oh.
Hold on. Let me make sure that I have you as a presenter.
Does that work?
There you go.
Does that work?
All right. There you go.
Okay. Sorry about that.
No worries.
All right. Maybe. So what does a nurse do? That is a very loaded question. We do a lot. Obviously, we're known for caring for patients and families through assessing patients, giving medications, and educate, but we also assist other healthcare providers in the field, whether that's a physician, a nurse practitioner, a physician's assistant, a paramedic, a respiratory therapist. I know I'm leaving other healthcare providers out, but really the nurses are the glue that holds it all together because we're with the patients the most. We prepare patients for procedures, and then we help keep the healthcare facilities running smoothly. You want to do this one, Molly?
Sure. So where all the nurses work. So that's the fun thing of being a nurse. You have a choice of where you want to work. So many of the nurses work in hospitals. We also work in clinics or doctor's offices, treatment centers, schools. I'm sure you all know your school nurse, nursing homes, and then home health. So in case you're interested in driving around the county and seeing patients in their homes. So
just some slight differences between the RN and the LVN nurse. We'll talk about the education in just a couple of slides, but both of them provide patient care. Both of them educate patients. Both of them are with the patient the most in the healthcare facility. But the RN can work just slightly more independently. They have what's called as nursing diagnosis. So your medical folks, your physicians, your nurse practitioners, your physician's assistants, they medically diagnose you with conditions like hypertension or diabetes. But then the RN also comes in and provides that nursing diagnosis that guides the care from your healthcare people that are taking care of you. So they'll focus on things like pain control, maybe helping get those blood sugars down, but they can do some things independently where the LVNs work more directly under direct supervision, whether that's from the registered nurse, nurse practitioner, or physician. The educational component that follows with the RN degree allows you to have more leadership opportunities. So if you're wanting to push up into management, run a unit on the hospital, be over a full hospital, chief nursing officer, and also you have to have the RN degree in order to transition to higher educational levels like your baccalaureate nursing degree or master's degree if you're aspiring to be a nurse practitioner.
So which program is going to be right for you? We do have an associate degree program, which after the associate degree program, you'll take a test to become a registered nurse. And we have the vocational nursing program. And after graduation, you'll take a test to become an LVN. So with the associate degree program, it does require prerequisite courses, okay? And the program is 2 years in length. It's 4 semesters. And afterwards, after graduation, you have the ability to test and become a registered nurse. For the vocational nursing program, it's a certificate program. There are no prerequisite courses, okay? And the program is only 1 year in length, so it's 3 semesters. So after 12 months, you have the ability to take a test and become a licensed vocational nurse.
And then once you finish, if you do the LVN track and become the licensed vocational nurse, then you can come back to Texas Southmost College, and the associate degree program has a track just for LVNs wanting to become RNs. And that's only 3 semesters, but it has the same exact prereqs for the program. I'm going to let you keep this one, Molly.
Thank you. So for the licensed vocational nurse, so what can I do? So what the LVN does, they provide basic bedside care. They take vital signs such as the temperature, blood pressure, pulse, and respiration. They also prepare and give injections and other medications. They can give enemas. They monitor catheters. They apply dressings. They can treat bed sores. They can give alcohol rubs and massages. You monitor your patients, report adverse reactions to medications or treatments. You also can collect samples for testing, perform routine laboratory tests, feed patients, record their food and fluid intake and their output, and you assist the patients with bathing, dressing, and their personal daily hygiene. So how much could you possibly make? In Cameron County in 2018, LVNs were starting at about $39,000 a year. And then the demand in the Valley for this job is very high right now. There are always shortages of nurses. There are also additional benefits such as sign-on bonuses and shift differential pay. So if you're willing to work that the dreaded night shift, you can make extra money working night shift.
And then to add a little bit different with the registered nurse, what they can do, everything that Molly just said about the LVN role, the RNs also fulfill those duties. But then we take it a little bit further. As I mentioned, we can educate patients. Registered nurses can also work in the public and be public health nurses and do some education with the community at large. They can provide advice, emotional support. They're going to educate both the patients and the families. They chart in the patient records. They provide, or they complete medical histories with detailed symptoms. They help perform diagnostic tests so they can be an assistant. There are some tests they can do themselves, or they can assist a physician or nurse practitioner. And then the registered nurse also analyzes those results so we can provide the data to the primary care physician to make the patient better. We operate medical machinery, administer medications and treatments, and then we also provide follow-up after discharge and in rehabilitation settings. Currently, or in 2018, the average salary for a registered nurse in our area was around $65,000 a year. The demand is extremely high for registered nurses in this area, as well as the LVNs. There is a shortage in almost every aspect that the nurse can work in. As Molly mentioned, there's sign-on bonuses and shift differential pay, but there's also tuition reimbursement opportunities at a lot of our facilities in the Valley, so they will help you pay for extending your education. So if these programs, if you want to make a difference in someone's life, one of these programs is In Your Future. This is our website on how you can find us. We're under the Divisions of Health Professions. You'll find both the LVN program and the RN program listed, where you can find the steps to apply to be in our programs. And as seniors in high school, you can be taking some of the prerequisites in a dual enrollment at your high school. So you definitely want to check those out if you're interested in either one of our programs. That does conclude our presentation, but we will take any questions if anyone has any.
Molly and Beth, we definitely appreciate the information that you shared. Thanks, and it was very visible, at the beginning of this and during this pandemic, that we were seeing buses come in from nurses from out of area, right? Because there's a shortage of nurses. So for those of you that are really considering this career field, I can tell you it looks to be a very rewarding career, because you're making the lives of so many a lot better.
Very true.
All right, let me share the last. I'm not sure what I'm seeing right now. Okie dokie. So webcams. Okay. I don't know where my PowerPoint's at. Give me a moment. There it is. So thank you both for that presentation. We definitely appreciate everybody joining us for this session. We want to thank once again our committee from all the institutions of higher education, the school districts that are part, along with the employers, and last but not least, certainly Workforce Solutions, Cameron, for believing in us at RGV Lead and continuing to partner with us to provide these this annual event. This is the 19th annual, like I said earlier. So we definitely appreciate them being a part of this. And then last but not least, we want to make sure that all the students that participate have an opportunity to share their feedback. There is a survey. If you open your phone, you're able to show that to the screen. Complete the survey, submit it, and then we're going to have a live Facebook drawing on the 10th of November. And then there's Chromebooks, there's wireless earbuds, portable phone chargers, wireless printers, and how to get the job book by Todd Ayton, who presented yesterday for us. So we definitely appreciate each and every one of you being a part of this. We are going to send the link for the survey either today or tomorrow. But if you have anything else, please don't hesitate to reach out to us. We'll definitely try to make the communication streams very easy for you to reach out to our panelists that were a part of our program for Health Science Part 1. Please note that we do have Part 2 of Health Science coming up at 1 o'clock this afternoon. So we hope you can join us. Thank you so much. Panelists, definitely appreciate you being a part of this. Thank you so much. And this ends the webinar. Session number 11, Health Science Part 1. So thank you all so much. Have a great day.